Afternoon, everyone. Hi, I'm Javon, and I'd like to welcome you all here to Chiswick as we talk about sexual health today, and I hope you will take something from it. Let us pray. Dear Heavenly Father, thank you for bringing us here today. Thank you for life. And Lord, as we talk about sexual health today, I pray that you help us to remember the guidelines and the principles you set out for us. Also, Lord, I ask you to help us to remember that you said our bodies are temples of the Holy Spirit. Thus, we should treat it accordingly, Lord. Continue to bless us, Lord. I pray this in your name. Amen.
The one and only Michelle. What's going on, Michelle? What's going on, Michelle? A round of applause for Michelle. It's all good. It's all good. It's all good. It's all good. Oh, do you want a mic? Yeah.
Evening, everyone. Okay, so our talk today is about sexual health. Okay, so I was going to ask you guys, what is sexual health? But as you can see, it's already up there. So sexual health is making sure that you protect yourself when you're sexually active. Okay. Now, we have to remember, when we talk about sexual health, the law of the land says that your age of consent for having sex is age 16. Yeah? But remember, this is the law of the land, okay? And children under 16 are still allowed to have sex as long as they give consent. But if any child under the age of 13 is having any sexual intercourse and it was with someone older, it's an offence, and it's an offence which can send them to prison. Two people who are at the age of 15, if they're having sex, or 14, they will not prosecute because of them being the same age. But if someone is age 13, 14, and then they're having sex with someone who is age 25, then that will be dealt with, basically. Okay? But just remember, as I said, this is the law of the land. It's not law that we should be following. Okay? So consent. So whenever anyone has any sex, they need to give consent. So consent is two people agreeing to take part in any sexual activity. And they have to have the freedom and capacity to have sex. And when I say freedom and capacity, what do I mean? Does anyone know what I mean when I say that?
They need to be fully capable, like they can't be drunk or high, or they just need to be like in their right mind to be able to agree to it.
That's right. Also, when they talk about capacity, they're also talking about if they're mentally ready. So when we see people in the sexual health clinic, we go through a performer to see if they understand why they're having sex, if they understand why they're doing what they are doing. If they haven't got capacity, they can't consent to the sexual activity, okay? So consent is not assumed. So just because you say you consent to having sex once, you can't assume that you're going to consent again. So people can't assume that you're going to say yes again. Consent has to be communicated clearly. So if I say yes, I say yes. If I say no, I say no. And if you do partake in any sexual activity and you consent to it and you decide to change your mind, you have the right to change your mind, and people should not force you into anything you don't want to do, okay? Yeah? Yeah? Okay. Also, consent needs to be respected. So as I said before, if you withdraw your consent, people need to respect that, okay? All right? Now, STI. Does anyone know what STI stands for? If you do, put your hand up. Not Javon.
Sexually transmitted, disease. I know disease, so I don't know. Oh, infections. Yeah.
Well done, thank you. So yeah, STI stands for sexually transmitted infection. Now, STIs are very common, and when I say common, they are very common. So in 2022, there were over 392 STIs diagnosed in England. Over 82,000 diagnoses of gonorrhea, and chlamydia, which is over 199,000. And chlamydia is one of the most common of all the STIs. Now, there are different ways to transmit an infection. Anyone have any idea? How can you transmit an infection? So how can you give an infection to someone else, or how can you get it from someone else?
Having sex. Yeah.
Any other thoughts, anyone?
Giving blood.
Yep. Anything else? No? Any adults? No? Yeah, sharing of needles, yeah. So you can catch an STI from different types of sex, and this could be via the vagina, orally, or from the back. You can get an infection which is transmitted from mother to baby. You can get an infection via skin-to-skin contact, sharing of needles and equipment, and also by the exchange of bodily fluids. Now, one of the infections which is very common is something called gonorrhea, okay? So, as you can see, this is a tip of a genitalia, the penis, okay? And gonorrhea generally looks like a yellow, thick discharge, okay? Some people might have a small amount of discharge. Some people have so much discharge that they actually wear a pad, okay? And the common symptoms are some people find it really difficult and find it painful to pass urine. They can get swelling of the opening of the penis. As I said, they get a yellow pus-like discharge. And they can, depending on the sex they have, so if they have sex via orally, they can get a sore throat. Okay? This is a woman, okay? And this is what it looks like in a woman. So a woman can get the same kind of symptoms. They get burning, passing urine. Sometimes you can get a fever. They can get bleeding in between their cycle. So they have a period today, the period stops, and in between the next period, they can get spotting of bleeding. And that could be a sign of infection. They can get some sharp pain in their lower abdomen, and they may feel that need to go to the toilet more frequently. Okay? Anyone can give me another infection? Thank you, Noel. So there's another infection which is called chlamydia, okay, which is found in both men and women. But this is one of the infections which a lot of people do not get symptoms, okay? So when people come to our clinic, a lot of people, they just come for a just general checkup with no symptoms, and it turns out they've got an infection called chlamydia. So with chlamydia, in women, they can get heavier periods, and they can get a lot of pain in their pelvic area. So it's usually generally in the lower abdomen. So it's not the stomach area, it's right low in the abdomen, okay? They can get irregular periods, pain passing urine, and when they have sex, they can also have a lot of pain. With men, they could get pain during passing urine, swelling of the testicles, burning or itching in the urethra, which is the part where the opening of the penis, and they can get a cloudy white discharge. With these infections, there is treatment, but the more you get these infections, the more you are prone to other infections. With chlamydia, especially in women, if this infection is not treated, it can make a woman infertile. So with chlamydia, it's important that it's picked up in women. Okay? And when I say it can make someone infertile, what do I mean by that? Thank you, Tanya. So some women may not be able to have children. And the reason why, when you get chlamydia, and if it's not treated or they keep getting it over and over again, it can cause a lot of scarring in like their fallopian tubes. So it can make the make it difficult for the sperm and egg to reach each other. So this is one of the common symptoms why a lot of women cannot get pregnant. There are other reasons, but this is very common as well, okay? This is a picture of chlamydia. So the lower picture is a picture of a healthy cervix, okay? And we know the cervix is where our menstrual period comes from and where the egg passes, the sperm passes in order to meet for the egg in order for someone to get pregnant. But when you look at the top cervix, that's an infected cervix, which is chlamydia. So you can see the outside of the cervix is very red, and when someone has sex and they touch the cervix, the woman can bleed a lot because the cervix is very pliable, it's very fibrous, and it's very red, okay? And then you can see the discharge coming out as well. So just like gonorrhea and this chlamydia, more the gonorrhea, in order for us to see if someone's got gonorrhea or an infection, we can see it under the microscope. So we take swabs and look under the microscope to see these infections. Okay, so this is an infection called trichomonas. This is not one of my favorite infections. I do not like this infection. This infection is caused by a parasite, okay? And it's a living parasite. So when you look under the microscope, you see it swimming, you see its legs all, yeah, and it's not very nice at all. And because of this is one of the reasons why when someone has something called trichomonas, they get a lot of itching. And it's because of this parasite which is swimming inside the cervix. So you can get some pain passing urine, just like the other infections, and you can get this abnormal discharge. And with this discharge, when you get trichomonas, can you see the bubbles? You get a frothy discharge with trichomonas, okay? And it can be quite, have a bad odor as well, okay? Also with chlamydia, you can't see it on this picture, but women get something called a strawberry cervix. So the cervix, you know what a strawberry looks like with the dots? The cervix will look like that as well. And that's one of the telltale signs when someone's got this infection of trichomonas. They can get some burning passing urine as well. With men, it's very difficult to pick up trichomonas because of the way their anatomy is. Their urethra is very long, so it's difficult for the trichomonas to live and travel. Because it's difficult to pick up in men, if they're in contact with someone who has this infection, we don't tend to look for the infection, we will just treat it. Yeah? It's not a nice infection to look at, is it? And could you imagine having something inside just swimming around you? Yeah? Not nice at all. And I'll show you what it looks like under the microscope. That's what it looks like. And you see the long flagella, those legs? That's what you see under the microscope, and it's just swimming. Not nice. And you don't just tend to see one, you see quite a few of them. And that's what's causing all the itching and the frothy discharge. Okay, so there's another infection called herpes. This is part of the cold sore virus. So, you know, some people get cold sores on their lips. It's the same virus, which is the herpes. So the one on the lips is called herpes type 1, and the one which is found on the genitalia is herpes type 2. But even if someone has a herpes sore on their lips, if they kiss someone on other parts of the genitalia, they can pass this virus on. This is not a nice infection. You get blisters, which are it's the first episode, which is very, very, very painful. Some people, they can't walk. Some people, if they've got it really bad, they can't even pass urine and they have to go to A&E to have a catheter passed. This infection can be quite dangerous. And it's passed on via skin-to-skin contact. When you look at the blisters, it's a fluid-filled sac. So when people come in, they tend to have the blisters, but they also have the open blisters as well. So we have to swab it to send it off to the lab. There's no other way of diagnosing it. Some people come in and say they want a blood test to check for herpes. But we don't do blood tests. There is a blood test to check, but the reason why we don't do a blood test, if you had 10 people, 9 of us have probably got the herpes virus, because not all of us have the symptoms. Yeah? So the blood test doesn't mean anything. We would only test someone when they actually have the physical signs of the blisters. Sometimes some people come in with the blisters and they come in probably 5 days later after they've got the blisters. There's no point because we can't swab the blisters because at about day 5, these blisters are healing, so they've crusted up. What we want is the serous fluid inside the blisters in order to diagnose the infection. So as I said, some people, will have pain passing urine, and even if they haven't got it around the urethra, when they pass urine, when the urine passes it, it burns really bad. They can get a discharge and they can get tingling. Now, with herpes, even though you see the blisters, some people, even though they haven't got blisters, they can get something called asymptomatic shedding, and they know when they're coming up with herpes because they start to feel itchy and tingly. And once they start feeling that, we tell them no sex because that means the virus is active and you're going to pass it on. Depending where it is, some people will still have sex because we advise them to put a condom on. But when people have got herpes, they don't want to have sex because of how painful it is. Now, this is another infection called genital warts. Now, with warts, there are over 100 different types of warts. And if you think about it, there's warts which children get on the fingers, and verruca is a type of wart. And when women have cervical screening, they also look for the wart virus on the cervix as well. So these are usually found around the vaginal area or the buttocks, or some people can get it on the bum cheeks or in between their legs. Some men can get it inside the urethra. Now, if they get inside the urethra, it can be dangerous where it could stop them from being able to pass urine properly. And sometimes they start off as small lumps. And we get a lot of patients that come in and say, oh, I've got a spot, or I've got some lumps. And you ask them, how long have they had it? Oh, I've had it for a year. Because they don't really think nothing of it. They just think it's a spot. But as it starts to get bigger, then they think something's wrong. And you get clusters. I have seen warts which have been the size of a small cauliflower. That's how big they can get. And when they do get that size, they have to go for surgical treatment. We can't treat it in the clinic. Usually when we treat this, it's either by a spray, which is called liquid nitrogen, or cream. And it can cause scarring of the skin and pigmentation, especially in black people. The warts, you can see, are different shapes. So you can get flat warts, and you can get warts which are more fleshy. And as I said, some women also can get it inside the vagina as well. Some women can get it on the cervix, but we don't treat the cervix. They would have to go to gynae for that. Yeah. Okay. We'll go on to the next one. Now, this is syphilis. Does anyone know anything about syphilis? No. I find this one a bit of a complicated infection. It's not one of my favourites. Now, syphilis is found in the blood. So there's 3 stages of syphilis. There's the primary, which is the first stage, which presents like an ulcer. And you can get this anywhere on the body, whether it's the penis, vagina, the back passage, the tongue, or the lips. This lesion can last for up to 10 to 3 months, and then after that, it usually goes. But after that, once it's healed, you get something called secondary syphilis if it's not treated. And this presents as rashes either on the hands or the feet. And it's a non-itchy rash, and you can get it on places like the torso, the back. So when patients come in, the doctors will tend to examine the whole body if they think there's any sign of syphilis. Some people feel very tired. They get headaches, and we also check the lymph nodes as well. Now, once it's gone past this stage, this is where it gets dangerous, and this is called tertiary syphilis. This is the last stage of syphilis, which can cause stroke, dementia, numbness, paralysis, deafness, heart disease, skin rashes, deafness. And it can affect the brain. So you can see it affects the brain, the liver, the heart, and bones. If it's not treated, it can also lead to death. This is passed on via skin, more bodily fluids and blood. It's very difficult to diagnose this. We tend to do it via blood tests, but you can also diagnose it under the microscope. And under the microscope, it is very pretty. So basically, it looks like a, what do you call this shape? Yes. And when you look under the microscope, it glows and it just swims. But as I say, it's very difficult to diagnose. So what we tend to do is send off a blood test to lab to help diagnose this infection. It is on the increase, and you tend to find this infection more in men who are having sex with men, or also people from a high-risk country. And we tend to find people who, from a high-risk country, if they could have been born with it and we didn't know about it, or, yeah, but tend to be more in men having sex with men because of their practices. There's another infection which is passed on via blood. Does anyone know what this is? Anyone over there? Yeah, HIV. Now, HIV is also picked up via blood. Now, what people need to know, you do not get HIV from sharing utensils. You do not get it from insect bites. You do not get it from kissing or touching. And you do not get it from sharing clothes or sharing towels or sharing toilets or showers. Okay? You can get it via infected needles. A woman could pass it on to her baby via pregnancy or even breastfeeding. You can get it via blood transfusion, organ transplants, and unprotected sex. With HIV, especially men who are having sex with men, is on the decrease. They've got this medication now which men can take every day, or they can take it when they want to, which will prevent them acquiring the HIV infection. Can you imagine that? So because of this, they're taking this medication to prevent them catching HIV, but they're forgetting about all the other infections. So hence why chlamydia, gonorrhea, and syphilis started to skyrocket, because all they thought about was the HIV. HIV, we tend to find a lot of HIV in people also from high-risk countries who didn't know they had HIV. People think HIV is picked up from just from men having sex with men. But you don't know. I had a patient once. She came to the clinic. She had sex once, and she was HIV positive. No, isn't that sad? Most of us in the clinic, we cried for her because we just thought her first sex, and she picked up HIV. So it's not just, from men having sex with men, or it's not just people having sex with lots of people. You don't know who you could be sleeping with. You don't know, you can't tell who's got an infection or who's got HIV just by looking at them. Yeah? So it's easily picked up, and so that's why it's always important to people who are having sex to use condoms. Okay? We always say prevention is better than cure. We're not encouraging, but it can happen. So if you're going to do anything, you need to protect yourself, okay? With HIV, if untreated, it could lead to something called AIDS, okay? But AIDS these days now is not really heard of because of the treatment that is there for HIV. And people with HIV are living longer than us who don't have HIV because they are having treatment. Also, their care is, they're looked after. So they have good dentistry, they have good checkups, their whole health is looked after. So because of HIV treatment, their lifespan is longer than ours. Okay? Hi, Maya. Okay. Now, there's an infection called molluscum. We see it a lot in our clinic, but it's also children get it a lot as well because it's part of the pox virus. So it's easily contracted via skin-to-skin contact. So, children could get it from just having a bath together, just sharing towels, just playing with each other. It's very contagious. So when you look at it, it's these little round blister-like spots, but it's got a fluid inside which is very, very infectious. So we always tell people, don't play with them, don't squeeze them. When we've got a spot, what do we like to do? We like to squeeze them, yeah? But if you do that, you can spread it all over the body as well. But we get patients, we also see patients at our clinic as well because if they're having sex, their skin is rubbing together. So if they don't know someone's got the molluscum virus, they're easily going to pick up the molluscum virus as well. What I forgot to say, going back to the wart virus, as I said, if you had 10 of us, 9 of us have probably got the virus in us, but we don't have the symptoms, okay? With the wart virus, you can't tell who passed it on to who. So if someone's had sex with someone at the age of 16, they could have picked it up with 16, but they've reached 30-something, they've got pregnant, or some kind of stress has happened in their life. That's when the virus comes up. Because what happens is your immune system has been compromised and the wart virus comes up. So you get some people, they come in all crying, they've got this virus. They say, oh, my husband or my boyfriend's been cheating on me. We say, you can't say that because you don't know. And this virus has sometimes nearly broken up couples. You can never say, you passed it on to me, you passed it, because you don't know. A lot of us live with the virus in our body for our whole lives, and we don't have any symptoms. People get symptoms of the virus if you hear they've had a bereavement in the family, they've got pregnant, they're very stressed at work. It's all down to your immune system. So because your immune system is low and it's been compromised, the virus comes out. And that could be the same with the herpes virus as well. Now, if someone is having sex, young people, all young people and older people, have the right to access any clinic. And it's free and confidential. Okay? So if Javan was to walk into a clinic, he can be tested, treated, get advice without me knowing. But what we always encourage is for them to either, if they haven't told anyone, encourage them to speak to a parent, speak to an older sibling. They can even speak to a GP, or we have people who they can speak to as well. But we always encourage them to speak to someone, but we can't force them. And they're allowed, they can access the clinic as long as they understand the emotional and physical implications of what they're doing. They're not being forced into what they're doing. And what we always advise them when they come to the clinic is it's a confidential service, but if we think that they're at risk or any other children at risk, we will break confidentiality. So if, just say, Javan was 14, he came to the clinic, he said he's having sex with someone who's 25, we would break confidentiality. And especially if he thought that he was being exploited. So you get a lot of young people. So for example, I had a young girl who came to the clinic. She was 14 and she was having sex with multiple people. But when I spoke to her about what she was doing, she didn't really understand why she was having sex. She didn't know the people she was having sex with, and she was just meeting people on the street. So that's when we had to let her know we're going to break confidentiality. We had to inform our safeguarding lead. And that's when we get them into the clinic. We've tried to find out if they're under any social services, you know, because there could be a reason why things are happening, why they're doing things they are. But just to let you know, it's all confidential, but if we need to break confidentiality, we'll break confidentiality, but we will also tell you we are going to break confidentiality. We will never do it without you knowing. Okay? Does anyone know if they had an infection, what would you do? Where would you go? If you thought there was something wrong, what would you do? What would you do, Rhea? No? And I'm glad you said that. That's very good. That shows that, you know, not everyone can speak to their parents. I know when I was growing up, there's no way I would speak to my mum. No way. And luckily, I had an auntie who I could speak to. And I think it's a generation thing. But I find now, children now are finding it easier, not all children are easier to speak to parents. And from when I'm working at the clinic, you can see the ones that there's a kind of, how can I put it? You know the ones that can't speak to their parents. So I will say, so English people, they can speak to their parents, but you tend to find that Africans, Caribbeans, Asians, they don't speak to their parents. And I don't know if it's, I'm not sure why, probably it's how they were brought up. And it's just passed down. So they find it difficult. And this is worrying because if they can't speak to someone, they will do something and they tend to do things without advice and just keep things in. And that can be dangerous as well. Yeah? So children, you know, and parents, we need to try and encourage our children to speak to us. And, you know, if they come to us, try not to judge or jump down their throats. Just talk to me in love and give encouragement. Yeah? Now, in order to prevent an STI, how can you prevent getting a sexually transmitted infection? Yes, Javan? Yes, use a condom. Anyone else? That's right. Abstain, keep your legs closed. Anything else? Don't be shy. Girls, sorry. So to prevent getting an infection, so you can have an injection. So with the injection, it's things like, which they roll out in school now, is the HPV vaccine. Now, I remember when the HPV vaccine came along, I was like, my child is not having a HPV vaccine because my child is not sleeping around. That's where my mind was. And then my sister-in-law said to me, but Michelle, think about it, God forbid, if she was assaulted or she had a partner which she didn't know had been sleeping around who has got the virus. And then it got me thinking, because my brain was just in that mode. So I do encourage parents to let their children have the HPV vaccine, especially when they come to me and ask for advice, because a lot of parents are of the same mindset with me. My child is not sleeping around, but it's not just because of that. Yeah, you've got to think about what the other person's been doing as well, or if anything was to happen. As someone said, I think it was Tonya, keep your legs closed, and I think that's the first thing we should be doing. Using condoms, and also a way of preventing infection is to try to have a monogamous or one-on-one relationship, because it's more easier to get an infection when someone has lots of partners, yeah? And then when you think about if this person's having sex with this person's having sex with this person, you've got to think about who they're having sex with as well, and it's multiples, yeah? So there are some myths about sexual health. So it's a myth that people who go to the GUM clinic, and GUM means genitourinary medicine, which is the sexual health clinic. It's a myth that it's only for people who are promiscuous and dirty. Some people also come to our clinic because they have a change in discharge, and it could be due to thrush, or it could be due to something called bacterial vaginosis. Now, bacterial vaginosis is not a sexually transmitted infection, but a lot of women get it, especially Black African and Black Caribbeans. Can anyone think why? I know you're not going to guess, but can anyone think why? Sorry? Say it, Sonia? I'll tell you why. So because what people got to realise, when women get discharge, it's the body naturally cleaning itself. Now, they don't tend to do it more now, but back then, what a lot of people did, what did we bathe in? Okay. You always know who's bathing in Dettol, or they're washing a lot, or they're washing inside the vagina. Because I used to wash with Dettol, and it wasn't a capful. I poured a whole bottle in the bath. Because you think you smell nice and you're clean. But because of this, what you're doing, you're stripping away at the good bacteria in the vagina. And you're getting an overgrowth of bacteria in the vagina, which is causing a discharge. And if you know your job, I can walk past someone and know they've got BV. Because it's got a very bad smell, which smells like fish. So you have to train people's mind not to wash down below so often. So you can wash morning and night, but we tend to tell them don't wash with soaps or shower gels in the vaginal area. So when you tell some people that, they're like, oh, you don't need to use soap down below. You could just use plain water. Or what we encourage them to use is something like aqueous cream, Dermal, or E45, and use it as a soap substitute. So people don't just come to our clinic because they've got an infection. They come for many different things, yeah? When you come to clinic, people will not find out you've been to a GUM clinic. In the clinics, they have designated days for young people, and it tends to be for children who are 18 and under. And this is a space where no adults are allowed to come, and it's just for young people, and it's for their confidentiality. And what we don't want young people not to do is not to come to clinic because they're frightened of seeing someone, a neighbour down the road or a family member, because they won't attend the clinic. So they have a designated time for young people. Another myth is if there are no symptoms down below, you are clear from an STI. No. Because as I said before, some infections don't have any symptoms. Okay? Another myth is you cannot catch an STI via oral sex. You can. And another myth, which some people today still think, that contraception, so like taking the contraceptive pill or the contraceptive injection, some people think it will protect them against a sexually transmitted infection. No. So when we get women coming in for the contraceptive pill or something, we always tell them to use a condom as well, because the pill is not going to protect them from any infections. Another myth is people think they're a good judge of character and can tell by just looking at someone they've got an infection. Yeah, and it's not true. And this is more so with HIV. People think they could just tell who's got HIV, and you can't tell who's got HIV. Yeah? Another myth is if you have sex with someone living with HIV, you will get it too. No. So with HIV, if I had HIV and I'm on treatment, and when the HIV virus is more infectious, it's to do with your viral load. And the viral load, if your viral load is very high, that tells you how infectious you are. But when they take the medication, the viral load can come down to 0. And I can have sex with someone and I won't pass it on. Yeah? So just because you have HIV and you're on treatment, you may not be able to pass it on, as long as you're taking your treatment properly. Another myth, as I said before, is you can catch a sexually transmitted infection from the toilet seat. No. And another myth is women who have sex with women cannot get a sexually transmitted infection. They can. As long as there's bodily fluids, you can pass on the infection. Yeah? Any questions, anyone? No? Okay, I'm going to give you a little quiz, okay? Now, put your hands up, yeah? Number 1, do all STIs have symptoms? Not you, Joanne. Thank you. That's correct. Can all STIs be treated? Anyone? Come on. Can all STIs be treated? Stop laughing.
I don't know. No.
They can all be treated. But there is one infection you cannot cure. Does anyone know what that infection is? Before that. HIV. You can't cure HIV. Yeah. Also, another infection that you can't get rid of is the herpes virus as well. That will always be in your body. Okay? If you think you may have an infection, what should you do? Jovan?
Talk to someone or go to the clinic.
What would you expect from the clinic?
Treatment and advice.
Thank you. What do you think might be involved in a sexually transmitted infection test? So how do you think, if someone's got an infection, how do you think I would try to find out if they've got an infection?
Swabbing or a blood test.
Well done. There's one more thing. Think about men.
What did you say?
There's one more thing.
Think about what? I don't know.
Yeah, we send off a urine sample. So for chlamydia in men, we send off a urine. Chlamydia in women, we have to send off a swab. But all in other, as you said, other ways of testing for an infection are via swab, urine, and blood test. Okay. Sometimes, if we can't, before we send off a test, we could just diagnose and treat on the spot. Because it's better to treat what we think might be an infection than leave it. Because if you send them away without treatment, then they go and have sex with someone else, and the results come back, they have got an infection, they're going to pass it on to someone else. Are infections only passed on between men and women? Thank you, Rhea. That's right. They're not. So it's passed on between men, women, women and women, men and men. Okay? Can you tell someone's got an infection by looking at them? No, of course not. Once treated with an infection, do you think someone can get the infection again? Yeah. So one of the ways they can get the infection again, so when you treat someone with an infection, basically, when someone comes into a clinic, we say to them, when did they last have sex? Now, we don't tend to send off a test unless it's 2 weeks after the last sex they had, because there's a window period for the infection to show up, which is usually 2 weeks. But some are longer. So for syphilis, it's 90 days. HIV is 45 days. So if someone came to the clinic now and they had sex 2 weeks ago, we'll still do the blood test, because we've got to think about people they might have had sex with before, but we tell them to come back in 45 or 90 days to repeat the test, because then it's more accurate. We tell people, when we treat people, we tell them, so if it's something like gonorrhea or chlamydia, we say no sex for a week once they've started treatment, because it takes a week for the treatment to work. If they have sex in the time during their treatment, they would have to get that person that they had sex with to come in for treatment, and they would have to come for retreatment themselves, because it's like ping pong. You just pass it back and forth. And as I said, if you just keep passing it back and forth and keep getting infection over and over again, you're putting your body at risk of damage. So as I said, in women, it can be infertility. And then we always say, if it's something like gonorrhea, if they do have the infection, they've got treated, they need to retest in 2 weeks. Because when we give them a treatment, which is an injection, some people are resistant to the treatment. So we also send off another swab to check they're not resistant to the treatment. Yeah? And everyone should know this. Can you catch an infection from going to the toilet? No. Because a lot of these infections and organisms, once they leave the body, they just die. They don't live outside the body, okay? I know a lot of us probably don't sit on toilet seats, but that's not the reason why we don't sit on toilet seats. But you can't catch anything from a toilet seat, okay? Any questions, anyone? Yes, Mr. Jeffrey. Going on, hitting 14. Yeah.
The other question is, when you see young black men, when you see young black men, what is their, how do they feel when they're having unprotected sex? Do you advise them that they should be wearing condoms, etc., etc.? And what sort of feedback do you get from them?
So when I see young black men, I talk to them. I'm real with the black men. In the clinic, you have to assess who you could talk to the way you talk to them. So a lot of black men don't like to wear condoms. a lot of black men have this mentality. So one black man said to me, he was getting gonorrhea over and over and over again. I said to him, if you keep getting gonorrhea, you're going to put yourself at risk of HIV because he just damages his immune system. And in a polite way, he said to me, you can only catch HIV by sleeping with men. So I said to him, I said, you're really ignorant, you know. I would not say that to all patients. I said to him, you're really ignorant. So he looked at me, I thought, oh gosh, he's going to report me now. I said, you're really ignorant. I said, what planet are you on? I said, it doesn't matter if, you can catch HIV via, I don't know all the different ways, but it's not just a gay men's infection. You get a lot of heterosexuals who are getting the infection as well. And one of the reasons why I've learned, it wouldn't be one of the reasons, but I've seen it with a lot of black men. We have a performer which we go through to ask, when they last had sex, who they had sex with, male, female, how many partners. A lot of black men will tell you they've got a regular female partner, but then some of them got a regular male partner as well. And what I have to advise them is, what they don't they're saying they're having unprotected sex with their female partner and unprotected sex with their male partner. I said, but what you've got to realise, I can't tell them how to live their life, but if you're going to have sex, use a condom. Because whatever you might pick up from there, you're going to bring it back to your wife or your girlfriend. But then, a lot of them don't realise that how easy it is to pass it. They just think they're, what's the word? Yeah, they think they're invincible. But none of us are invincible. Doesn't matter. Infection can be passed on to any one of us. Yeah. But a lot of them are starting to, when you speak, you have to just retrain their mind. They don't see, a lot of men don't see anything wrong with having multiple partners, but it's on the increase with women too. Sometimes I sit there, as people who know me know that I wear my heart on my sleeve, right? So sometimes I'm sitting there, when they're telling me some of the things that they're doing, I'm sitting there in my head, I'm having a conversation, but I'm talking to them at the same time. And in my head I'm thinking, you're disgusting. I'll be honest, I'm talking, and sometimes I have to pray when I'm talking to some of these patients. I pray for myself because I'm worried that I'm going to one day say what's in my mind, it will come out my mouth. But what I have to try and do is not be judgmental as well, which can be very difficult. But I just see them as people it's like a shop floor, just people just coming in. And you wanted to ask something, Maureen?
It's two things, really. I remember in the early 80s when HIV/AIDS was the thing, and I mean, literally, that was like COVID. Mm-hmm. Yeah, we feared that more than anything else. And now you talk about HIV, once you take your medication, you're okay. What's the life expectancy for somebody who has HIV?
They're living longer than me and you.
Okay, so they can just live a normal life once they take their medication. Okay, it's interesting. The next question I'll ask is just a thought for our young people who, obviously growing up innocent and everything, but the challenge they will face is that as our teens grow older, they'll meet other potential partners, so to speak, and those potential partners could have been very active. What advice do we have for our young people? Because, they might be very pure, but then be at risk of something that's detrimental to their health. How do we... Sorry I missed all the other bits early.
We can't assume that everyone we meet is, promiscuous, having sex with other people, or... For my children, I just pray. because I worry about when they meet people. I pray that they meet someone who is wholesome, who hasn't been sleeping around. I just pray that Lord will protect them. Because you don't know someone's past. You could be married to someone and still not know their past. You don't know. Yeah. Yeah, and their present. You don't know. So I think you just have to go in faith, basically, and just... Any advice, Tony, would you give? Okay, yeah. I just go in faith and just pray. Because you don't know someone's past or their future. And you can't go around worrying all the time, oh, I like this guy. Oh, but, you can't go around. Because you'll never. And if you keep thinking like that, you could miss out on, the right person for you.
Well, thanks, Michelle, for that. That was an excellent presentation. Something that touched me that you said is the young person. I don't know if she was young, but it was the first time she actually had a sexual encounter, and she contracted, HIV. So one, you may have said, but how do you deal with those sorts of very emotional, situation or experience? So that's one thing. And the other is, when you talked about the herpes, you said there were two, isn't it? Did you say it's sexually contracted as well, the herpes?
So herpes, you can get herpes, HSV1, which is the oral herpes, and you get HSV2, which is the genitalia. But you can pass HSV1 onto the genitalia as well. You can pass it. So, you can get it from skin, so two people kissing, get it, but you can get it from mouth to vaginal penile area or from skin-to-skin contact. I forgot what was the question now. That was a really long time ago. I know it did affect me, but coming back to present, there was another patient I had. It is hard. So I had a patient, she was 15. She came with her mum. But when we see patients, we always encourage the parent to wait outside, because if you get the parent to come in, the young person does not open up to you. So I had her in the clinic, and I started going through some questions. And then I said, asked her when she last had sex. There was a question I asked, I can't remember, and she started screaming. And she curled up in a ball, and she just started screaming. And I kind of froze. I didn't know what to do. So I thought, I'm not going to hug her, so I had to quickly get her mother in. And it turned out she was dating someone who was 19, and he was using coercive behaviour. He was physically violent. He was abusive. And I remember I wanted to cry, but I couldn't. I had to be professional, and I had to get a health advisor who was more experienced than me to come and speak to her. When she left, I cried. Because working in this field, it makes me think about my children, and I worry about my children. You know that saying, what you don't know don't hurt you? Yeah.
So, when you see young people come into your clinic, and they tell you things, they disclose things, you treat them, and then you really believe that their parents should know, but they don't want their parents to know. But you really think your mum should know this. Is there anything you can do? There's nothing you can do.
Confidentiality.
Even
As
if they're
long
like,
as we have a guideline to follow, it's called the Fraser Guidelines, which checks to see if they're understanding. We check to see. We look at things like whether they're in school. We look at things like what their home life is like. We try to tease out whether they're being coerced. We ask things like, are you being paid, or given gifts? We go through a lot of questions. Once they part, we can't break confidentiality. I could lose my job.
I mean, those Rochdale kids, nobody knew. Their parents would have wanted to know. Their teachers would have wanted to know. They didn't tell anybody. They went to clinics. They had STDs all the time. Nobody knew. Somebody really ought to have known. They could have stopped it straight away.
So, as you said, something must have been missed there. So if you come to a clinic, there's certain things, questions you ask to try and tease out these things, and we have health advisors, which, if I think this, I get the health advisor to speak to them, and they have the experience to find out if anything's going on. But I don't know how that was missed. I can't understand. Javon. But Viv, we can't break confidentiality. Unless we thought they were at harm of danger or any children, we thought that they're being coerced or they're being trafficked, they gave some kind of, then we will break confidentiality.
Under the age of 18, what age do you see like most often? And
What do you mean?
Like what age of people normally come into the clinic? Like 13-year-olds, 14-year-olds, blah, blah.
We get 50-year-olds, we get 60-year-olds, we get 14, we get multitude of...
And what do you say to like teens who come in with like STIs and stuff like that?
We treat them like everyone else, but we have to give them advice and we have to teach. Because some of these young people, they're not taught. They just go in like they're invincible. And unless they know what the consequences of their actions are and what it could lead to, then... So it's all about teaching and education.
Also, like you're saying, obviously don't do it, but if you are to do it, then do it with protection, innit? But what would you
Prevention is better than cure.
Yeah, what would you say to the teens that, like, they feel like they can't go somewhere to get their protection, like the condoms and that, they don't want to walk into the shops and all them stuff like that, because they feel embarrassed?
So they can come to our clinic. And as I said, we have a young person's clinic, which is a whole afternoon on a Wednesday. And other clinics have young person's clinic. We also say you can also go to the GP or another GP, because a lot of people don't want to go to the GP if it's their family GP. Yeah, because GPs don't seem to have the same confidentiality as we do. So even if we saw one of you guys, we couldn't tell your GP unless you gave us consent. Yeah? So what's the question again, Joanne?
You see how you were saying about like using protection, and you see the teens that would, obviously, if they were to do it, and then like, and they were embarrassed of like going into the actual like shops and stuff like that, where would you tell them to go?
Sexual health clinic. Yeah. And if they can't go to sexual, see if there's anyone they could talk to who could encourage them to come or that could come with them. And young people, there's also people in church we can talk to. We're not all ogres, yeah? You can also talk to us as well as adults, yeah?
Does the clinic like give free protection?
Everything is free. So contraception is free, treatment for infections is free, even HIV treatment is free. It's all free. I had a patient once who was an American guy. He came here for holiday. I said to him, "Oh, you're here for holiday?" He goes, "No, I've just come to this country to get my HIV treatment because it's free." Yeah. Everything's free. When it comes to sexual health clinic, it's all free. So you even get patients who, back in the days, we had a walk-in clinic. We still have one now, but we just have it. Back in the days, it was a walk-in clinic for the whole day. So some people could sit in the clinic for like 5 hours waiting to be seen because they got thrush. Why do you think they would sit there? Because it's free. Everything's free.
How do you go about helping people who are sexually coerced into things? What do you say to them, and what action do you take?
So in our clinic, if we think someone's being sexually coerced or anything like that, we have a safeguarding lead. So we automatically refer them to the safeguarding lead, and they would have a multidisciplinary meeting with doctors, the nurse, health advisor. They might include people like the police, if there's a social worker involved. So they discuss with a multidisciplinary, a group of people as to how to sort it out. But I don't tend to get too involved. If I think there is something, I'll refer it to someone who's more experienced to deal with it. Because not one person can deal with it by themselves. Anything else? Danielle.
There we go. It's the first time I've ever heard of, is it trichoma?
Trichomonas.
Trichomonas. What is that? How does that even... Yeah, could you tell me a little bit more about what that is and for everyone? Because you said it was a parasite.
It's a parasite.
Yeah, I've never heard of that.
Which is passed on via bodily fluid. So it can only be passed on via sex. Back in the days, they used to think you could get it via saunas because of how warm the sauna is and the water and everything. But it's more passed on via sexual contact. And it just lives...
So is it
It tends to live underneath the cervix, where it's nice and warm. And it's just passed from person to person. It doesn't... So how is it for... I don't know. I know what you're trying to say. I don't know.
Okay.
I don't know how it grows, but yeah.
Yeah. Because it has to survive somehow, but...
Yeah, inside the vagina, where it's nice and warm. And it's got all the fluids there, and it just swims.
Yeah, I've never heard of that before. So, yeah, no sex before marriage, guys.
Yeah. I didn't talk about contraception because that's a different field, but also contraception is available, and that is what will protect you against any unwanted pregnancies. Because it's better to protect yourself against pregnancy, and then you get pregnant, and yeah. So always think about contraception as well. Yeah. Yes, Jovan.
Like, what do you guys do if, like, a teenager, I'm saying, like, talking like 15, like someone like 15-year-old comes in and pregnant and something like that?
We always encourage them to speak to the parents. But as you know, confidentiality is again, and it's all dependent on what they want to do. So unfortunately, some people do not want to continue the pregnancy, so we have to refer them. If they do want to continue, then we advise them where to go and what to do. But because they know what they're doing, and confidentiality is, we can't break confidentiality still. And there's times where you just want to but you can't. Sometimes you get even get people come to the clinic. You might get a couple, and Javan's got an infection, but the woman's there. She hasn't got an infection. You can't even tell the partner your husband's sleeping around, love. So the way I get around it, I just say, they come and say, oh, I've got this infection, I don't know how I got it. And I know full well what the partner's, because I've got the partner's notes. I said, well, just take note, it's only passed on via sex. That's my way of telling them, and you get patients still saying, but I don't know how I got it. I said, listen, read my lips. It's passed on via sex. And that's the way I try to hint to them, if you ain't been doing nothing, someone else has. But I can't physically say to them, your partner's been sleeping around. Yes, Daniel.
Again, thank you for that. That was so informative. You spoke about different types of contraceptions and stuff. Could you kind of speak more on the effects of the implant on females?
What do you know about the implant?
And the side effects of implants, because we can talk about different types of contraceptions and say that, okay, yeah, like having condoms and stuff like that. I know a lot of individuals nowadays, or females, they tend to go onto the implant because they feel as if, okay, yeah, once I'm on the implant, I'm good for the next, 3, 4, 5 years, however long it is, 3 years. But then in the impact and the effects that has on their mind, it's of the devil. But I wanted to know if you can maybe speak about that a bit more.
One size does not fit all. So what might affect you may not affect you. Some people, the implant is the best thing since sliced bread. And the implant is a device which is placed under the skin of the arm, and you can keep it in for up to 3 years. And the way that it works, it just puts your ovaries to sleep. So some people say, oh, I don't want to go on contraception because it might affect me getting pregnant. It doesn't affect fertility at all. As I say to patients, you don't know what your fertility is like until you start trying. So it just puts your ovaries to sleep, and it just puts like a mucus plug in the cervix, preventing sperm from passing through. Some people, you've got to remember, it's a hormone, so it's a natural hormone which is in the body. It's called progesterone. But some people, it can make them feel a bit low, but it's not with everyone. Yeah? There's other contraception which some people might have, and it might not fit them. There's only one contraception that doesn't have any hormones, and that's the copper coil. And that can stay for up to 10 years. But as I said, Daniel, it doesn't affect everyone. Contraception is all down to the individual and what is suitable for them. Some people like the implant because they don't have to think about taking tablets every day, and they keep missing tablets, and then that's when they get pregnant.
You know, like the IED and the IUS, do you have to be like a certain age to get it?
We fit it in people like 15. We don't tend to fit it in young. When they're young, they don't want the coil. Because number one, they're fearful of the discomfort and the pain of having it put in. Young people tend to go for the tablets or the implant, or even the injection. But a lot of young people don't tend to go for the coil.
Is there any consequences, not consequences, like any side effects of like taking like the pill for women and stuff like that?
So as I said, the side effects are, depending on what contraception you need to go on, is mood change. With the implant or progesterone only, you can get, we say to people, you can get unpredictable bleeding. So you can have a little bleed now and not have anything for 2 years and then start bleeding. You can have a bleed every month. Or some people get prolonged bleeding, and some people have nothing at all until they remove the contraception. But there's no long-term side effects of contraception. Yeah?
Hey, I know I read some stories about a male contraception being put on the market. Do you know if men come in and inquire about it, and do you know whether it's actually something that will actually go mainstream? Or
Men they're not interested. Because it's always down to the woman, isn't it? Huh? It's all down to the woman. They don't want the male contraception. And you don't really get men coming in asking about the male contraception. I don't know nothing about it yet, but it'd be interesting to see the uptake of male contraception if it was to come out. It's all down to the woman. Oh, Maya.
Does the menopause affect getting like STIs?
Whether you're menopausal or going through the menopause or you're having periods, it doesn't stop you from getting infection. Anyone can get infection. Even a 90-year-old could get an infection. Yeah. Okay. No more questions? Thank you. Thank you very much, everyone.